Welcome to Final BDS Made Easy. Define oro-antral fistula, write in detail the signs and symptoms of 24 hours old oro-antral fistula and how will you manage it. It is one of the 7 marker questions in the subject of oral and maxillofacial surgery. It is defined as an epithelialized pathological unnatural communication between these two cavities. Next are the signs and symptoms of a 24-hour-old oro-antral fistula. Communication between the oral cavity and sinus may be seen through a visible opening at the site of the recent dental extraction or surgical intervention, often found in the region of the maxillary premolars or molars, and based on the fluid movement. When drinking, fluids may pass from the mouth into the nasal cavity, causing nasal regurgitation. Next are the sinus-related symptoms, which is nasal discharge. Patients may experience a watery or purulent nasal discharge as a result of fluid moving through the fistula, or sinus congestion. There may be a feeling of congestion or fullness in the affected maxillary sinus. Oral symptoms, that is bad taste. Patient may report a bad taste in their mouth due to the movement of fluids and possibly infection. Pain and discomfort. There may be localized pain at the site of the fistula, especially when the patient applies pressure to the area or during oral activities like chewing. Nasal symptoms are epistaxis. There might be occasional bleeding from the nose or nasal sounds. Air may escape through the fistula, causing a whistling sound during talking or breathing. General symptoms are fever. If an infection has started, the patient might have a low-grade fever or swelling. There may be localized swelling around the extraction site or maxillary sinus. Next is the management of a 24-hour-old oro-antral fistula. First step is initial assessment, that is clinical examination. Conduct a thorough intraoral and nasal examination to confirm the presence and the size of the fistula. Imaging. Take an OPG or a CBCT scan to assess the extent of the communication and any associated sinus pathology. Second is primary closure. It can be done using flap techniques. If the fistula is less than 5 millimeters, primary closure with a buccal advancement flap or a palatal flap may be performed. Buccal advancement flap. This involves creating a trapezoidal or rectangular mucoperiosteal flap, advancing it over the defect and suturing it to achieve a watertight closure. And palatal flap involves rotating a mucoperiosteal flap from the palate to cover the fistula. Suturing. Use absorbable sutures to secure the flap in place and promote healing. Sutures should be placed carefully to avoid tension and ensure a good seal. Next is the postoperative care. Prescribe antibiotics to prevent infection like amoxicillin and clavulanic acid and nasal decongestants to reduce sinus pressure. Advise the patient to avoid activities that increase sinus pressure such as blowing their nose, sneezing with their mouth closed or using straws. Follow-up. Regular monitoring. Schedule follow-up appointments to monitor healing and ensure the closure is intact. If the primary closure fails or if the fistula is large, consider more complex surgical techniques such as using a buccal fat pad, graft, or other advanced flaps. Management of complications. In case of sinusitis, treat any concurrent sinusitis with appropriate antibiotics and decongestants, and in cases of recurrence or persistent fistula, more advanced surgical interventions might be necessary. Early identification and management of a 24-hour-old oro-antral fistula are crucial to prevent complications and promote healing. If you like this video, do hit the like button, share it with your friends, and please subscribe to my YouTube channel. Stay tuned for more such videos.